Thank you, and good afternoon, everybody. First, let me begin with a couple of comments about the plans to gradually and safely reduce restrictions in St. Louis City and in St. Louis County that is tentatively targeted for May 18th. First of all, I'm extremely grateful to everybody in the community for coming together and slowing the spread of the virus. That absolutely saved lives. The decisions made by elected officials and public health officials, and really it was the hard work, diligence, and vigilance of the entire community made this possible to slow the spread and to decrease the transmission of the virus. So now, as we're beginning this initial phase of opening up parts of the economy and safety, it's even more vital that we continue to look at the data to make sure that we're going in the right direction and to reinforce all of those evidence-based practices like washing hands, social distancing, keeping surfaces clean, all of those things, so that it can continue to make a difference and continue to decrease spread in the community. So before we get to the numbers, I wanted to revisit some of the information that I'd shared with you previously, and this is about the reproductive factor. And so as many of you know, the reproductive factor represents how much spread can occur in the community given an infected individual. And so the lower the number, the better. And so the way to interpret it is if you have a reproductive number of 5, one person ends up infecting 5 people. So obviously if you can get that number below 1, then that means there's no more spread occurring. So as you've heard me say before, we believe that when the virus was first introduced into the St. Louis metropolitan area, that number was probably close to 5. And the reason for that is we weren't practicing any social distancing. We weren't being as diligent about washing our hands, keeping surfaces clean, all of those things, and we were freely moving about the community. And so that allowed the virus to then ramp up very quickly, to spread very fast, and it resulted in those high numbers of hospitalizations that we saw. And then through the different policy things, as well as adopting all of those principles, such as washing hands, keeping surfaces clean, we believe that we were able to get that number down to around 2 when shelter in home was instituted. Now after that, and adopting all of those other social distancing, other factors, we believe we're around 1 right now, which is, we'd like to be even further down, but we're happy with 1. And so after all of those things were instituted, it really took us off that worst case curve that I've shown you before and put us on that more sort of gentle slope of our best guess scenario. And so it was because of all of those efforts that we were able to really knock down the number of cases that were transmitting in our community. And that's a really important piece to understand because it's critical that we drive the transmission rate down as low as we can using all of our available means as really a prerequisite for when you're thinking about reopening the economy and loosening up any social restrictions. And so I guess the point of me telling you all this is even though people talk about reopening the economy or loosening social restrictions, it's going to be a new normal. We still have to practice all of those really important things to keep transmission low. We don't want the cases to ramp back up. So that's just a plug for all of those things that we should continue to do even as we start reopening the economy. Now let me jump over to hospital admissions rolling average. And so when you think about the reproductive factor, how does that show up? Well, it shows up in some of our hospital data. And so as I've mentioned in the past, the testing data is a little bit more difficult to interpret because of the way that it's reported. So it doesn't necessarily report on the day that the test is performed. And so the numbers moving over a period of days are a little bit more difficult to interpret. But we know that a percentage of patients that are positive are going to show up in our hospitals and be admitted. And so that's why we started looking at this average of incidence data. And so incidence data is the number of new patients that show up on the hospital on any given day. And then we can track that number, and it gives us a broad approximation on what does it look like out in the community. And then in order to understand what the trends are, and so you've heard me say we don't worry as much about fluctuations from day to day, what we really want to do is look at trends. And so a good way to do that is looking at a rolling average, and we chose a 7-day rolling average. And so when you look at our 7-day rolling average for new admissions, you can see that that number is starting to come down. And so it's lagged by a couple days because we want to make sure that we're capturing everybody. But as you can see, we admitted 29 new patients on Monday, which is pretty low. I think that's actually our lowest number we've ever had. And our 7-day rolling average is around 39, which again is pretty low. So this is a trend. We're going to keep our eye on it, see how this changes going forward. But it's another positive sign that we're really headed in the right direction. Now I'll switch over to our moving average for our hospitalizations. And again, we're encouraged by this number as well. This number is much more flat than the one that you saw earlier. But as you can see, from early April when those cases were really starting to rise, we hit that plateau, which I talked about, which is probably the result of shelter at home and all those other things. And it's become a little bit more flat now. And there's a couple of reasons for that. One of the reasons is our patients are staying in the hospital still get counted even if they're ready to be discharged. So if we're having challenges with getting people discharged to like long-term care facilities or skilled nursing facilities, they still count in this bucket even though all things being equal, we would have discharged them by now. And so this number is a little bit challenging. We still rely on it though, but I just want to make sure that everybody understands there's caveats with all of these numbers. But that's what makes this process sort of interesting is we're learning new things as we go along. We have different challenges in our healthcare systems that we hadn't recognized before. And so when we look at the data, we want to make sure we're providing a really accurate picture on what is occurring out in the community. And that's why we're starting to look at some different metrics like that incidence admission number as well. So we're assured that we are decreasing spread, that the number of COVID cases is coming down so that we can make these really important policy decisions based on good data. The other piece of that, let me go back really quickly, is we want to make sure that we're identifying where the areas are where transmission is occurring. And by that, I mean the spread is not equal in all parts of our community. There certainly are spots where there's more activity than others. And so think about those long-term care facilities where they can have spread really quickly. And so that increases the numbers of our hospitalizations, but that doesn't mean that transmission is increased throughout the community. It really means it's increased in this one particular spot. And so as we've gotten better at this and started looking at the data in a much more granular level, now we can start identifying where are the areas where we need to really be concentrating our activity so that we can make a much more informed policy decision and a much more informed response to those cases that are coming up. So I just wanted to put that out there as well. So now let's get on to our case numbers our hospitalization numbers for today. So as you can see on the slide, we have 630 hospitalizations today of confirmed COVID and suspected COVID patients. And that's down fairly significantly from 673 yesterday, so that's great news. We have 145 confirmed COVID and suspected COVID patients in the ICU, which is down from 158, so that's good news as well. And we have 118 confirmed COVID and suspected COVID patients on ventilators, which is about the same as yesterday, where we had 117 patients. And of course, our good news slide, 45 patients, COVID patients were discharged yesterday from the hospital. That brings our cumulative up to 1,508 patients since we began tracking this number. And again, this is it's a tremendous accomplishment, and it wouldn't have been possible without all of our healthcare heroes and really the support of the entire community. And so a big thank you from all of us for helping make this happen. So before I wrap up and take the questions, I want to address a couple of things which are related to COVID, not necessarily to these numbers or to COVID patients, but have been reading as well as hearing from my colleagues that they're not seeing as many other types of patients in the hospital, such as stroke patients or heart attack patients, things like that. And that's a little bit concerning because really COVID shouldn't be affecting those types of patients. People will still have strokes, they'll still have heart attacks. And it's concerning to me if people are foregoing coming to the hospital even with minor symptoms because they're afraid of being exposed to COVID. And so I want to assure everybody that the hospitals have gone through great lengths in order to make sure that they can create a safe environment for everybody. So whether that is COVID patients or whether it's non-COVID patients, we've segmented off parts of the emergency department so that we can effectively take care of all patients. And so I would just want to make sure that people knew that signs of heart attacks and strokes and other things can have very subtle signs, but they're still serious signs. And so if you're experiencing any of those, you still need to come to the emergency department or call your physician to be evaluated. I would hate to see somebody having some sort of poor outcome because they were too afraid to come to the hospital where they would have come earlier had it not been for COVID. So please, we've gone through great lengths to make sure we have a safe environment for everybody. So if you are having any of those symptoms, make sure that you're seen quickly. And so with that, I'm going to turn it over to answer questions from the media.
Will it be safe for St. Louis City and St. Louis County businesses to reopen on Monday, May 18th? Does the data show the region is ready?
A couple of answers to that question. So is it safe? So the things that we use for is it safe, so we look at the data to see are the cases coming down, and I think I've showed you, yes, we believe that transmission is coming down. And so by that marker, I think we're on the right path. But the other pieces are the businesses developing their plans to really make for a safe environment. And if you use grocery stores, and I'm sure most people have gone to the grocery store during this pandemic, and they've done a really good job of building plans on how to do social distancing, washing all of the commonly touched things, the plexiglass, all of those things. And so all of those businesses will really have to take those guidelines to build out their appropriate plans to protect customers. And then people will need to also adhere to all of those things that we've been talking about before, such as wearing a mask out in public, making sure you're washing your hands frequently, not gathering in large groups, all of those things. And that's how you create the safe environment. So it's really up to all of us, the business, the community, everybody.
If the city and the county reopen and cases should begin to spike, would you recommend that another stay-at-home order be put into place?
So we'll, without a doubt, be following all of the data. And so, as I mentioned earlier, I think the things that we need to focus on now, so following the data and then making sure we understand the data better and understand, are those cases a cluster of cases that are happening somewhere, or is this widespread community cases that are showing up? Because you would want to do different things for different scenarios. So of course, if it was a cluster of cases, like in a long-term care or in a particular community, then you would want to devote your resources there. If we're looking at the data and it looks like, hey, this is really widespread and it's the transmission is going through the roof, then I think that would be a different discussion.
Compared to the St. Louis region, the Kansas City area has had a smaller coronavirus outbreak so far. Are there any reasons or explanations for that discrepancy?
Yeah, that's a really difficult question to answer. All of the different metropolitan areas are a little bit different. It could, and I'm purely speculating here, we could have had sort of a underlying transmission going on within the community before we even realized it. And so I believe our shelter-in-place orders were right about the same. But if we had more virus circulating in the community than, say, they did in Kansas City, then that would explain some of the spike in the cases. There's differences in air travel. There's all sorts of different things that play into that. But I would mention that there was meat processing plant just north of Kansas City where there was a large number of people that were asymptomatic that tested positive. And so I wouldn't equate, absolutely their smaller hospitalization numbers with smaller numbers of infection. But, it's certainly an interesting question, and I'm sure that's something we'll be looking at going forward.
Thank you. That concludes the list of questions received from members of the media prior to and during the briefing. Tomorrow, the task force will issue its updated numbers via press release, and the next live stream will occur Friday afternoon. Thank you for tuning in.